Welcome to Dr. Sudha Murthy's channel. Today we'll discuss how to draw a pedigree chart for an individual who's been advised genetic counseling for hereditary cancer panel testing. Pedigree chart, by definition, is a chart which is utilized to trace the inheritance of a specific trait, abnormality, disease, or cancer in an individual's family. This is drawn by a genetic counselor or a medical professional who is conversant or trained in genetics. Few ground rules before we go on to the actuals. The males are represented by a square, female is represented by a circle. When this circle or square is crossed, it indicates that the individual has died. In a relationship, a horizontal line indicates a couple, that is, they are married, a line of marriage, and the husband is generally to the left. The vertical lines indicate children, and the siblings come under these family branches. Now, generally, the oldest sibling is to the left, and as we move to the right, it is the youngest sibling. When there are cross striations or the box is filled by these diagonal lines, it indicates that the individual is affected by the disease or the trait. Now, with this background, let's move on to an illustrative case. This is the story of a 26-year-old male whom we call the index case. So everything is with reference to this index case, and this is represented by an arrow to the left of the box. So in our case, it's a male, that's a square, and since the patient has colonic polyps which are suspected to be malignant, it is indicated by diagonal lines in the box. Now this individual is married. His wife doesn't have any family history. They have a female child who is 2-year-old. This index case or our patient has 3 siblings. The oldest is a sister who is 33-year-old and is diagnosed with colonic malignancy. He also has 2 brothers, one 31-year-old and the second is 28-year-old. Both are healthy. The index case's father is healthy and alive. He is 72-year-old. His mother had died of cancer at the age of 58 years. She had uterine cancer. The index case or the patient's maternal uncles, older one was 70-year-old and younger one 62-year-old. He had died of a road traffic accident, so need not be represented here. Just suffice it to say that he is no more. The index case or the patient's maternal grandparents. Maternal grandmother had died of cancer of unknown primary at the age of 42 years. However, his maternal grandfather is alive and healthy. His paternal grandparents were not affected by cancer. Now, if you look at this chart, it indicates that the chances of cancer running in the family are more on the maternal side, that is the patient's mother's side. So this is just a small illustrative case. There are many more. To understand this best, I would request you to go to standard websites to see how a pedigree is drawn, like the National Cancer Institute or the cancer.gov.